Meeting of the Health and Human Services and Veteran Services to order. First order of business, I want to welcome Mr. Brathwaite to our board. We're very happy to have you here, and we'll try to kind of go over some things today as we're going through the agenda to familiarize you with us. I know Angie already was speaking to you about getting an iPad for you, but I think we'll first go around and do introductions, and then we'll move on. So let's see. Start here and we'll go this way.
I met you yesterday. I'm Trish Clements, and I'm the director at Health and Human Services.
Karen.
Service officer here now. Others, the citizen members, the checker, Frank also used to be a neighbor of mine.
Oh, how nice.
So.
Great.
The button on the top.
Oh, okay. Thank you. Well, thank you. I was looking forward to serving on this community and this committee. I was born and raised here, left the area for a teaching career, and then returned back to Richland Center in my retirement.
Hey, good morning. I'm Tim Gottschall. I'm a county board member from District 9.
Ken Renish, Supervisor, District 6.
Ingrid Glassbrenner, I'm supervisor for District 10. I serve as the chair here, and I'm also a registered nurse member as well. I cover that. Terry? And maybe for those of you, I'll have you guys just introduce yourselves when it's like on the agenda, if that works out for you guys. I know online we also have Don Seep as another board member. Don, did you want to say anything?
Yes, good morning and welcome to Francis Brathwaite. My name is Don Seep, and I'm a representative of the Veteran Service Office, along with 4 other veterans here, Ken Renish, and our 2 citizen members. And I understand Mr. Van Landite and Sherry are both present. Happy to join with them and welcome Mr. Brathwaite and express my greetings to everyone else.
Thank you, Don.
So
All right.
She and I know each other, so.
Oh, okay, great. So like I said, I'll just remind the rest of you to introduce, there's so many awesome people online and in the room. So when they give their reports, they'll introduce themselves to you as part of, or what part they fulfill in the HHS department. Okay, so we already did our call to order. We have proof of notification, correct? Okay. So I need a motion to approve our 22-point agenda. Thank you. We have a motion and a second. All those in favor, please say aye. Aye. Any opposed? Okay. Were there any comments or corrections on the previous meeting minutes? All right. If not, I'll take a motion to approve those as well. Thank you. Great. Motion and a second. All those in favor, please say aye.
Aye.
Aye. Any opposed? Okay, that moves us to item number 6, review and discuss updates to the Richland County Capital Improvement Plan 2023. So that's item 6 in your packet. There's an agenda item cover as well as the spreadsheet. I know this is just on here for a discussion. So if you look at the agenda item cover, it has listed some of the key changes since the 27th of July. HHS would be the second one listed, which is moving the HVAC system updates from 2023 to 2024. So I think that's the main thing that would impact us. I don't know if anybody had any comments. Did you want to say anything, Director?
Krisha, your mic.
Sorry about that. Okay, so we met with Dan McGuire last week. He gave us some cost estimates and or is going to give us some cost estimates, really looked at the system, the building, what we have going on to give us a good idea of how much that is going to cost us. So we are starting to work on it. We are happy that it got moved to 2024 because we didn't think we'd be ready in 20.
Great. Any other comments on that? Any board members? Great. If not, then we'll move to item number 7. Again, this is just for discussion purposes on the updates to the county administrative reports, resolutions, and recommendations. So at this point, and I'm going to ask Tim to correct me if I'm wrong, because he's our representative on the finance and personnel meeting or board. I don't think there has been anything. It all still has to go to county board, the amendments that have been made at this point, correct?
That is correct. Notable changes yesterday, coming out of finance personnel, we approved a wage schedule that includes a 5% COLA increase. That's a change from the 4.5% blended cut in half, whatever, before. We're moving forward with the 5% COLA increase. And then I asked for additional review on the potential for a 2-step increase later on in the budget. So that is a significant change. No changes. In fact, we really didn't even get to discuss the budget for 2024, the pending cuts or the proposed cuts.
Can I ask you to clarify? So I think this was right before the meeting ended because I was trying to listen in. I know they were discussing sending things back to the departments to look at, and I think that was, you guys amended it to be for 2023, but with looking at the years following. Could you just state that better than I am doing?
Yeah, so 2023 is really set, or no particular action was taken in finance and personnel yesterday. Particularly noteworthy was a resolution being forwarded on to county board for 2024, which includes a proposed tax levy decrease for a number of departments, not just health and human services. So that will be up for consideration, I believe, next Tuesday at county board. Kind of the impending quandary that we need to figure out is the next 4 years after that. So 25 through the 7, I think, or 28. Finance and personnel has taken it as a charge to get those figures to balanced before this budget session is over, even knowing that there's a lot of things that are still a lot of estimates will have to be put in for those years. But the Finance and Personnel Committee will be looking to the individual standing committees. So our committee on recommendations for those subsequent years, in addition to 2024.
Okay, thank you. All right, are there any questions from anyone? Anything to discuss? All right, a lot to keep up on top of. As far, I actually had a question for this running report on the financial planning. Oh, I see it says at the top, the addition was the 1st of August. Is that correct? It has not been updated since then? Okay. Okay, that's what I was wondering as I looked through it. So thank you. Yes. Great. Okay, well, if there are no further thoughts or comments, then we'll move on to agenda item number 8, which is public comment. Is there anyone here from the public who would like to make a comment? Okay, and we will move on to item number 9, which is the Veteran Service Office Budget Summary. These will be listed as number 9 in your packet.
And after review, if you have any questions, just let me know.
there anything you wanted to share or anything notable?
No,
Maybe you could just describe it a little bit for the purposes of Mr. Brathwaite.
sure. So for expenditures for this month, it was, the only thing that was a little bit unexpected was, the computer software antivirus, payment was due for $227.58. That was the only thing that was unexpected. Besides that, we were finally billed for our advertisements in the newspaper. We have, line item budgets for a grant that we get every year from the state. We get a grant every year from the state for, they just increased it to $9,350. And then we have the money that comes from the general fund that's granted to us. And we have a very, very simple budget, very, very low.
Any questions for Karen? All right, that will move us to item number 10, which is your administrative report.
We've hired a new benefits specialist in the office, Hugo Santiago. He's an Army retiree, 23 years. He worked for the JAG Corps on the civilian side out of Fort McCoy. And he is very, very familiar with federal regulations. We had a 5-person panel, and they all unanimously voted that he was a good candidate. So we're welcome to have him. He has already proven to be quite an asset in the office. He has more knowledge on some of the programs, actually Excel spreadsheets and stuff like that. He's actually increased our productivity from what it was prior. So besides that, we will have our booth at County Fair again next month. We're looking forward to that, and just ask everybody to stop by and say hi.
Thank you. Okay.
I have one question. How many applicants did you have?
Well, we had about 10, and there were 6 that came in to take the exam. The MIS department helped us to advertise online on Indeed, and that was a huge asset. So we were really glad to have that happen.
All right, so I see it says to discuss.
Madam Chair,
Yes, Mr. C.
a couple of questions. Who were the members of the panel who conducted the interview and selection?
Don, I don't know that this is pertinent right now to our agenda.
She just gave a report on hiring a new, I think it is germane, on
Are
hiring
you
a new.
okay with him? Go ahead.
I've provided all that information to the county attorney, Mike Wendell, with all of the names and all the paperwork.
Well, I think it would be of interest to the committee. This is a question for the committee, and it's your responsibility to answer it.
So I had a member from this committee. I had a member.
What was their names?
I'm not sure if I'm allowed to give that out on record.
I honestly don't know.
You didn't have an interview in closed session, did you?
No.
So it's a matter of public record, and you have to honor that request.
It wasn't a county committee though, so I'm not sure on how to answer. I can definitely refer back to the core council and have him reach out to you, because he has been provided all those names.
So you're refusing to answer the question.
Mr. Seep, I don't think that's appropriate right now. Maybe we could discuss this at a later time.
One more question. Were any of the members of the Veterans Committee who were appointed by the county board invited to participate in this interview?
So the HHS.
Yes or no? Yes or no?
Yes.
Who were they?
One of the committee members that's here in the room today.
One of the 4 members who were appointed as Veterans Commission representatives to the committee. Were any of
Mr.
those for?
Mr. Steep, I'm going to stop you there because I know that you've already discussed this with Mr. Langreck as well as the county attorney. So I don't feel that this needs to be rehashed in this
No, this
meeting
is
at this time.
this is the business of the oversight committee. Point of
Well,
order.
actually, Mr. Langreck is Mrs. Knox's direct employer, and he's the one that you've been speaking with. And so I know that you've already talked to him. You can talk to the corporation counsel. I just don't think that this is an appropriate discussion if we're going to have heated feelings over this right now.
Okay, so you're not revealing a public record.
I'm not sure how to answer that. I don't actually know without asking corporation counsel what's appropriate or not. Had I known that this was going to come up prior, I could have checked into that, but I didn't know that.
Well, the report was in the agenda that she reported that she hired someone and
The specifics are not. Okay. Can we perhaps readdress this at a different time? I can speak with you after the meeting.
No, I think it's a discussion for the committee. There's no need for a private discussion.
I would like to check with Mr. Langreck as well as corporation counsel before, and then if they both approve it, we can certainly discuss this in an open meeting.
Madam Chair,
Yes.
since everybody's dancing around this, well, let's just put it on next month's agenda for open forum
Put what on the agenda for open
to
forum?
discuss the hiring process of Hugo Santiago. It seems that's what we're saying. We can't discuss it right now, so
I
let's
can
just
say
put
we
it on.
can't
Let's
discuss
put
it.
on
I just
next.
don't know the appropriateness of because I know that this question has already been asked of multiple people. So if it hasn't been answered, then I don't know if we can force Ms. Knock to say it in a meeting because I haven't talked with the corporation counsel. So
Right, that's why I'm saying it'll give you time to talk to corporate counsel, and then if Don has questions at the next meeting, we can handle it then, put it on the agenda.
Okay, I can look into that. All right. Anything further? Okay, then we will move on to agenda item number 11, review and discuss the 2023 Veteran Service Office budget. Now, I didn't see a thing in our packet for this.
They are in there. I just received them this morning.
Oh,
So
okay, so maybe I didn't update.
And they're listed under update. Update. There should be 4 updates. And it is agenda item number 11. I did talk with, I talked with Angie this morning. I apologize that, but they weren't published. They weren't typed and published until this morning. So I apologize for not getting them in there sooner. My instructions were a 0% increase. So our budget basically went from this column to this column, which was fine.
So you're saying it's the same as it was last year?
Almost exactly.
Okay.
There were a couple numbers that I moved around. I took $125 from postage and moved it down into registration fees. And that's because the national convention that moves around the country will be in Madison next year. It's $350 per person to attend the conference. And since national is being held here, our state convention will not be held. And it'll be in Madison, so we'll be driving back and forth every day. So there will be no lodging fees.
All right, this is just a review discussion item. Does anyone have any questions? Yes.
Madam Chair,
Just a minute, Mr. Steve. Mr. Gotchel's first.
Karen, just out of curiosity, is the proposed salary increases, would you consider that difficult to make up in your budget, or do you have room to account for those? Just trying to get a feel through the different departments, how that's going to happen, and if it's an extra burden.
The extra salary, I was actually surprised when you mentioned the 5%. I did not know that. So these numbers are actually listed at the 4.5. So I apologize that they weren't updated since yesterday. I think that the county is being generous in giving us those, and I think that they are appreciated. I don't think that it's hard because I'm not the budget person, to say whether they're a hardship or not. But if they wouldn't have come, I would have been fine with that. I really like my job. That pays a little bit more too, so.
Okay, I appreciate it. I don't know that I would have been fine. I was just curious on a smaller fixed budget, is probably a little more difficult than the larger budgets.
Yes.
So you say you're not the budget person. I guess I'm confused.
I'm at the county budget.
Oh, okay.
Yeah.
So when we look at your budget, then does that not factor in the 4.5%?
It does.
Okay.
But not the 5% that they.
Not the
allotted
extra half
from
percent.
yesterday, correct.
Okay.
That's not it on those numbers.
All right. Any other questions? Mr. Steep?
Yes, I'd like this whole matter placed on the agenda for the next meeting for further discussion, since this came on board with both Ms. Knock and was not notified to the 4 members of the Veterans Service Commission.
I'm sorry, can you clarify what matter?
I'm asking that it be placed on the agenda for the next meeting for
Right. What do you want placed on the agenda, Mr. Steep?
the 223 budget.
Okay. Well, as you know, we're just still in discussion mode at this time. There wasn't any.
That's correct. That's correct. But it's so new to us that we haven't had an opportunity to discuss it or to have. And Ms. Knock has not had an opportunity to.
Yes, that's correct. So because there are going to be some changes after the next county board meeting, I'm sure we'll need to revisit this. Does that answer your question?
Well, yes, I'm just asking that it be placed on the agenda for the next meeting for an update.
Okay, thank you. All right, any other questions? Okay, that will move us on to items 12 through 14, which have been grouped as consent items. They're information that's in our packets that we can review. However, because we have a new board member, I'm again going to ask that we go over them to allow us to familiarize Mr. Brathwaite with these. Please introduce yourself as you begin your report as well. So HHS expenditures report is the first one on number 12.
So I can go over that. Okay. So the document that she has up shows the expenses that we had for the month for outstanding checks, bills, et cetera, that we have. The first couple of pages, page 1 and 2, are mileage. So that is our drivers for our transportation program and reimbursing them mileage. Page 3 and 4 are vouchers that we receive bills for and we have to pay. Our fiscal manager meets with Clint.
Madam Chair, I can't hear anything.
I apologize. We're trying to fix, we're having some network issues right now, so the document is not loading. your director's report. Okay, so while we're working on this, we're just going to move down to number 15, which is our director report from Tricia.
Okay, so we'll start talking about Child and Youth Services. This past month, they participated in the National Night Out. That was a positive community outreach, and that was on the 2nd. I think it went very well. I think they had a great turnout, which was a wonderful event. Kaya Holtzman has been hired as a new case manager, and she will begin with the unit on Monday, the 15th. That unit has been very busy this past month with numerous new investigations. We continue to see a statewide trend of increased urgency when reports rise to the level to be screened in. We continue to explore options for family placement and in-home safety planning whenever possible to keep children with families and in the community while also ensuring safety. Some of the ADRC highlights, on August 3rd, they held their Fortune Cookies event. They had 77 people that were there. Since that play happened and that event happened, we've seen an increase in people requesting information regarding dementia-related resources, including requests for memory screens. The Elder Benefits Specialist and Disability Benefits Specialist are working on planning for the upcoming Medicare open enrollment season, which is October 15th through December 7th. They will be appearing on the WRCO morning show on August 23rd. That's always a very, very busy time. The ADRC manager attended the Dementia Care Summit hosted by the ADRC Regional Office. This meeting had representatives from 9 ADRCs, the Alzheimer's and Dementia Alliance, the Alzheimer's Association, and the State Dementia Care Specialist Program Manager. Discussions were based around how the organizations can work together to provide robust dementia care services to each county. Further discussions were also had regarding how to advocate for more dementia-related services, including crisis stabilization options across the state. This group is planning on meeting quarterly going forward. In the Public Health Department, nurses continue to respond to the COVID-19 cases. Cases have been higher in the last month and a half than during early summer. In July, our staff responded to 164 confirmed and probable COVID cases. And as of August 9th, we have seen 64 cases. Public health nurses continue to assist with community testing twice weekly and provide COVID vaccines weekly. The nutrition program coordinator has completed distributing the senior farmer market nutrition program vouchers for the season, and all 124 sets of vouchers were claimed by eligible community members. In addition, the nutrition program coordinator has identified a group of volunteers who are interested in providing home-delivered meals. These individuals work for a local employer, and the process of onboarding them will begin soon. For the behavioral health services, staff are looking at transition some of the CCS service facilitation services to a contracted behavioral health partners. Staff are working on completing the remaining protective placement reviews for 2022, and the 2023 CST plan was recently submitted by DHS for review. Finally, the community garden with UW Extension collaboration is finishing up for the summer months. Economic support is sad to report that they have had one resignation from the unit. We are recruiting for a replacement economic support specialist now with an anticipated start date of 9/19 with the state's new worker training to start 10/3. The state new worker training has been overhauled recently. Rather than starting the curriculum anytime, new worker training is starting every 3 to 4 weeks. Because of this, we have to be mindful of job start dates for new economic support specialists. Job start dates should be about 2 weeks prior to the state training starting. The economic support unit will no longer be handling the the Energy Assistance Program, and that's the WEAP program. So that's the Wisconsin Home Energy Assistance Program. So the state, through Energy Services Incorporated, is taking on this role. This was a decision that we had to make in the past month. We received less funds for this next heating season than we did in the previous heating season. We started to take a look at our budgets, what we could and couldn't accomplish, and felt we couldn't provide the services with the funds the state has provided to us. Over the years, the amount that we've been receiving has been decreasing each year. because they've had the online application process available. What's going to happen this year is people can apply online, and then the counties are going to be required to finish the application processes, but not getting any credit for that time. So in addition to getting less funds, they're also giving us more responsibility in regards to that program, and we felt we couldn't take on that responsibility. So it will be contracted out. The company that is doing it is going to be looking for a place to have an office in Richland County. And we'll also be changing some of our, like our voicemail to direct them directly to that number. We've already provided information to all the employees so that we can have a smooth transition of that program. Richland County Economic Support Specialists are responsible for taking 8.2% of the call center cases. For the month of July, they took 13.14% of the call center cases. So once again, the Richland County Economic Support Specialists should be recognized for their hard work and dedication because they are doing a great job there. My updates, just really wanted to report to you on changes to our mental health unit. Our manager has given her resignation. So Miranda Culver's been with the county, I believe, 7 years. And her last day here will be on the 18th of this month. She will be going to the Richland Center School District, so we really wish her well. We're also having one of the mental health therapists leaving, and her last day is also the 18th. And so this puts us in a little bit of a pinch for the short term. We have every intention of maintaining all programming, all options that we have there, and we'll be looking at some temporary supports that we can put in place until we can refill the positions. I'm hoping next month to come to you with a full plan of how things will look and what we see for our vision for that. Continuing to work on the budget right now. Any questions?
Tricia, I want to repeat back what I think I understood with the WEAP program is our funding is not at a level where we could justify. I believe that we've had temp staff or maybe even like hired some folks in the past to do this.
Yes,
Okay.
yeah. We have a hired staff to do it. She would do WEAP plus some of the overfill of the call center, not taking the calls, but more of the paperwork, face-to-face contacts with people. We just don't have the funds that they're giving us will not supplement that. We did talk about trying to ask for more from the consortium, and we did reach out to them. They said there's no guarantee that they could give us those additional funds to kind of balance that out. And so she will be a full-time economic support specialist.
Okay.
Yeah,
So
so
would that-
nobody will be losing a job.
So would that have what are the net implications to the budget? Are they negligible, I would imagine, because we've paid for that position with the WEAP funding in the past?
Yep,
Okay,
correct.
great. The second one was, I was wondering if you could go back to the nutrition program changes again. I want to make sure I understand them. It sounds like that's kind of a significant change for us.
I think the only thing with the senior farmer market vouchers, so what that is the state provides us with $25 vouchers for the farmers market that seniors can use. And we just distribute all of them. So that's a yearly program. That's all vouchers that come into us. We don't pay for them, and then we just distribute them in the community.
Okay.
But as far as nutrition program changes, there aren't any right at this time.
Okay. Thank you for that clarification. And one last thing, I wanted to thank Miranda for her service. It was a pleasure to get to work with her in the past, and she will be missed. I want to thank her for her service.
Thank you for that. I would echo that as well. I don't see her online, but maybe you can pass that along for the board. Were there any other questions for Director Tricia?
One comment.
Yes, go ahead, Don.
Yes, Madam Chair, I haven't had an opportunity to meet Trish. I thank you for your very fine report today, Trish, and I join with others in extending a hearty welcome to you to Richland County, and we wish you the very best in your new job. We know you're going to do well for us.
Thank you.
All right. How are we doing, Jamie? Think it will share. Trying to look at the agenda if there's anything else we can discuss without. I have it, but I know some people are having trouble with it loading. Did it load for you now? Okay. Yes, that would be great. Then maybe we can just go over it. So for board members that are on, that are joining us virtually, as well as anyone else listening in, we're going to discuss the HHS expenditures report, which is number 12, and it is in the packet on your iPad, as well as being available on the county website. So it looks like it's starting to pull up here, but if we have any other network issues, that's where we'll be going over.
So I can start with this page. So with this page is kind of just the overview. The first one is the transportation mileage reimbursement expenses. The second one is the vouchers that are reviewed between our fiscal manager and Clint, the county administrator, as he approves all of those. And then the third one is the vouchers that we have prepaid. And so we try to give you this information each month so that you have information on what our expenses are, what are we paying. And if there's at any time any questions that you have on any of these expenses, please let me know. And we can discuss any of those. One of the things that I do really want to point out is that we had quite a high expense with the Richland Observer and that's hiring ads that we've had. So in the past month, it was over $1,200. So we do continue to have those job openings. We are posting them per county policy. And so that does add up to be a pretty decent expense.
What page is that on?
That is on page 6, 5 and 6. So it starts at halfway down on page 5 and then ends page 6.
Okay. Any questions?
I was just going to say, does anybody have any questions?
All right, and we'll look at agenda item number 13, which is the 2022 HHS budget summary and Richland County placement report.
So what that is that this is the one-page document that we will provide to you each month. It really goes over what our original budget was, what our actual expenses have been, and then the percentage that we have utilized of that budget. So right now we should be at about 58%. And for some, we're doing pretty well. When you look at like nutrition and the economic support program, those are about right on to where we need to be. Some of those are less. And sometimes they're less because we've received additional funds that we didn't expect to have. It could be that we had less expenses, less staff. I think when you look at the child and youth services, they are under, but they continue to be understaffed. And so we had more positions budgeted that we just haven't been able to fill. So in the middle column, it then summarizes, do we project to have a deficit at the end of the year, or do we project to have some money left over? It does look like we're projecting to have a little bit of money left over, but we'll see as time goes on. And then our placements funds are on the last column. So we have placements of children placements and adult institutional placements. So the children placements are usually for their own safety, out-of-home care placements, kinship placements, relative placements, foster care, residential treatment centers. Those are the children placement, and the adult placements could be adult family homes, Winnebago, hospitalizations, and again, to protect those individuals from themselves. So we'll provide this for you every month. Are there any questions in regards to this?
By percentage, roughly, how understaffed are you right now? At 5%, 10%? Or the total number?
I think we have 7 open positions that are not on hold. Well, no, 9. We have 10 open positions, and I believe the total number of staff is 71. No, that's full-time.
Do you use that, Karen mentioned the MIS or whatever for reaching out?
We do post them on Indeed. If Angie wants to come, she does all of this, so she can give a better answer of where we all advertise.
Why that isn't working. Is it working? Can you hear me now? There we go. So yeah, we do all the local advertising that's required. Shopping News, Richland Observer. We've been doing multiple posts in those based on if it's a better time of the year to post or not, because a lot of these positions, a fair amount have been vacant long-term, unfortunately. And I also do Indeed routinely, which is free publication, and also Wisconsin Counties Association, which is a free publication. What I've been doing lately is going out. JobNet is a free publication. So there's about 5 or 6 different free platforms, as well as all the ads that are paid for that have costs, including sometimes we've done the State Journal, La Crosse Tribune. We've reached out, branched out from the Shopping News to actually other counties that do an online presence package for us as well, just to try to reach outside of the Richland County area, but still maybe grab some people that are in the neighboring counties. So yeah, we do a lot of advertising and a lot of outreach, largely free, but it's constant.
That answer your question? Any other questions or comments? All right, thank you, Tricia. So that will go on to 13B then, in our placements.
So our last item is the Richland County Placement Report. Look at adult placements. The top half is those Trumbull Healthcare Center, Winnebago, those type of placements. And so in June, we had 7 days of stay. I will give you a heads up that in July, our numbers are going to go up greatly. We had 56 days of stay in Winnebago for July. And so that'll change things a little bit. July was a rougher month for us. The lower half then talks about the community residential placements, which could be CBRFs, adult family homes, and those are the placement report. Right now we are looking at, we will be within budget. All of these are covered by levy. Right now, the way it's looking, we will be within budget for the end of the year. But the hard thing is when you're dealing with people, one thing could change and it throws it out the window. When you look at the child placements, I don't know if Miranda, you want to talk about it or if you want me just to go over. This one really tends to stay pretty stable right now. One of the things that we are starting to get reimbursement for is for those subsidized guardianships. The state has agreed to pay for all of those. And so there was money that did get reimbursed to us this past month, and then will continue throughout. And right now we have 3 subsidized placements. And again, we're at about 50% utilization, so we are foreseeing that we will be utilizing all of these funds at the end of this year. Any questions on that?
I did just want to mention, Mr. Brathwaite, so on these graphs, the different colors represent the different number of individuals. So when you see one that has a lot of different colors, they're each a separate individual. C, I don't know, want to go over these just to, I know they just get updated each month, but just so he can understand what we're looking at.
So what this is looking at is what our actual expenses are versus what we have budgeted. And so like we said, right now we're projecting to be under, but we've struggled over the years to have increased expenses over what we have budgeted. So that's this one. So these go by the different months of the year for the past 5 years. It kind of graphs out what our expenses were each month. Yeah. So it's just the different graphs that we have to look at the different placements that are out there, the different options that are out there, where our money is going to. And this has just over the years and goes over different things. If you would want to meet with us, Francis, and talk about this more, we would gladly sit down and talk to you.
Okay, thank you.
I would probably have our Jess sit in with us and Sharon from the mental health unit to give a really clear indication of all of this.
Thanks.
And you guys did have the orientation, was that recorded? Okay, so we could make that available as well.
I think the orientation recording is out there, but I think that you guys posted it, unfortunately, Gabe, under the wrong date.
Yeah, I guess what.
Yep, so it just needs to be switched.
Okay. All right, so there was an orientation done, Mr. Brathwaite, that was recorded, so we can provide you access with that as well, because there's a lot within HHS to try to get a grasp on. Okay, so if there are no questions then on any of that, that'll move us to item number 14, the HHS contract monitoring report.
Okay, so I'm Angie Reisner. I know you you and I have met a couple times. I've emailed you for all out of what's going on with this board meeting, but I also do contract monitoring and HR for the department. So contract monitoring is the report that's in front of you right now. I'll go again, explain exactly. So those of you that are a bit, you've heard this a few times from me, but what this is we have roughly 100 different contracts that we put out, just under $7 million. Just because we say $7 million doesn't mean we spend $7 million with all these providers. It's up to, we have the ability to spend up to that. And each one is monitored then every month. This report only is for those providers that are over $10,000. There are a lot of little residual under $9,000 different little agreements, they're called then, that are not on this report. So keep that in mind. These are the big ones that we actually, largely placements or client specific. So you won't see those details on here, but you will see the providers' names on the left. And this is organized based on manager in the middle column. So right at the top is the Southwest Wisconsin Workforce Development Board. That's something that's HR focused. So those are our leased employees. I manage that contract. We have an agreement for a contract for $525,000 at this time. They've billed us $220,000 through the month of June. So as you follow the columns along, that means we have utilized about 42% of the entire contract that we have with them. Since most of these providers have billed us through June, that's what you'll see I'll put at the top. June is a 50% utilization target, then is I do that little pink at the top. My database won't do that for me. So then we go through this report and we look at everything on the right-hand column that says percentage utilized. And I'll highlight anything that's concerning that tips over the 50% utilization mark that is my target for that month. So the third one down is Cholita. You'll see that I've highlighted that in pink. It is well over the 50% utilization, but I also highlighted right kind of in the middle of there, the current month invoiced. They've actually invoiced us through July. So we're actually on target then with that provider. As well as Forward Home for Boys, which is just a few more down from there. These are all children's. If you see the manager change is now Jessica Tisdale, so it's all the children's unit contracts. Forward Home for Boys as well, also has billed us through July. So that looks just fine. And then we flip another one down is A&J Vans. That is flipped now to Lori Cooey, which is Children's Long-Term Support and Birth to 3. That provider is well over that 50% utilization, but Lori has advised me that she doesn't intend on using them anymore. So that was probably going to be it for the entire year. I'm going to give it one more month, and then I'll change that current month invoice to December, because then I'll know that there's no more bills coming in, and I'll keep checking, but it should be just fine. Then it won't be pointed out every time. Any questions on page 1? Did that make sense?
All
right.
right. Following. Thank you.
Yes, good. So then I'll just keep flipping page. So page 2, everything looked okay there. No concerns. Page 3 looked fine. Page 4 is another one. Cario, just a couple up from the bottom, is July invoicing as well. So they're always billing us ahead of time. So that should be just fine. Page 5's looking good. And page 6 looks good. Any questions from the committee at all? So what we had talked.
I have
Sorry.
one. A lot of these are zero. Are these anticipated second half of the year expenses?
Yes, or a lot of those are with Lori Cooey's CLTS and Birth to 3 program, which are largely optional based on family choice. So if we had one family that maybe chose to work with, for example, let me find one, Gap Fit and Fun. She likes to have that in place, which is that local, you call it amusement park kind of place here in town. I think that's a bit of a stretch. I don't know what else they call themselves. But it's a fun, family fun center, basically, here in town, that she has asked to continue to do a contract with them. One thing I should point out, too, is, for example, see all those that are $11,000? She has no intention of spending $11,000. She may only spend $1,000, but in order to get the big contract written by me with all of the requirements, because yes, it has to be over $10,000. So we put it at $11,000. That gives me the cue that, yes, I have to write the big contract with all the protections for the county, because we're dealing with children with disabilities or birth to 3 kids. But she only intends on spending roughly $1,000. At this point in time, she doesn't have any families interested in using that or have requested that use at this time. But you'll see Easter Seals of Wisconsin. That actually is a perfect example. It was zero all this year. A family just used them. So now it's got $980 used. That probably happens the most, that zero balance with Lori's program contracts. We put a lot in place, not necessarily going to use them. It's kind of a wait and see which family picks, who they pick to work with. There's also a zero, just to point out, on page 3, Carly Adult Family Home. That's switching programs. Miranda Culver had every intention of using them, and then maybe the individual moved, and we didn't use them. So that's why I moved it to December invoiced. We don't ever plan on using them again. That will stay at 0. Does that help? Okay.
Mr. Van Landuit, you have a question?
Am I on?
Yes.
Okay. Quick question. You said these are all that were 10,000 or more. How many are there that are less than that?
There's probably, Jamie, 25, 30.
But they're relatively insignificant.
Yes. They're anything $9,000, 9,500 roughly, down to $1,000.
Okay. The second question, A&J Vance, why did they ever give an explanation as to why they were so high?
I think it was a one-time family use, and the expense happened to be this significant. I'm never given all the details of what's going on with the families or who the family even is. So Lori, if she was on, would be able to answer that a little bit more clearly for you
Not a
because she
problem.
works with the
Just
family.
Curious.
Yeah.
Thank you.
Yep, yep.
Thank you for all that information. That'll take us then, we've already covered number 15, so that'll take us to number 16 on the agenda, which is to review and discuss the 2023 HHS budget. And we do have that in our packet.
So what I want to start out with by saying is, I know this was due to the administrator's office on Friday, but it is still a work in progress. We did not incorporate the 5% wage increase. We had it all turned in at 4.5%. And Stephanie's on vacation now, so the 5 hasn't been added. But that is something that we will work on. Our levy request as it stands right now is more for this year or for 2023 than it was for 2022. We continue to kind of dig in, look at different things, try to find ways that we can make cuts. But incorporating those wage increases was difficult. I mean, it's much needed for the employees. We could absorb it in some of the units. Our economic support unit, it was absorbed. For the most part, ADRC was absorbed. Some of the behavioral health positions are absorbed. But there were some that did make an impact on that levy. When I look at children and youth services, historically, there has not been levy in that program due to the reclasses and the wage increase. And with the hope and fingers crossed that we'll be full staff, we will have to be requesting some levy for those programs there. And so those are some changes that I've noticed. So our levy increase is about an additional 98,000 from last year to this year. Excuse me, from this year to next year. Some of the other things that have increased it a little bit is for some programs, we have a percentage that we have to match. And so if the amount that the state is offering to us has increased, the percentage we have to contribute increases. So that is another thing that makes an impact on the budget. Any questions on anything? One of the things that I really want to point out is with the economic support unit, because there's lots and lots of questions in regards to that unit. And I want to just continue to relay this information. So we have a maintenance of effort that we are required to contribute of the 153,272. That has been in place since I believe 2012, and that has not changed. We are part of a consortium. That's our obligation to the consortium to make that program run. In 2015, it was decided to add 8 additional positions to Richland County with no additional expense to Richland County. And so we got those 8 additional workers. There wasn't any expense that was added to the county. Our maintenance of effort has remained the same. So for 10 plus years, we've had that exact same maintenance of effort. There are lots of questions about why do we have so many more economic support workers here than other counties of comparable sizes or even of larger sizes. At the time they were added here, it was because it was cheap labor. And so the consortium said Richland can add 8 additional workers much cheaper than Columbia, Dane, Sauk, any of those other counties that are in the consortium with us. And so I know there's lots of questions that are asked. I don't know where they're coming from, but I really want to stress that we are having those 8 additional workers here at no additional cost to the county. In addition to that, we get overhead costs that are provided to us for each of those workers. So if we decrease those workers, that overhead cost that goes into the administration budget goes away. And so that would be something that would start to hurt our budget if they start to cut those economic support workers.
Madam Chair.
Yes, Mr. Steve.
Yes, thank you for the report. Just one question I think is pertinent. These economic support workers, are they not funded by a grant? All of them?
Not all of them. So to be part of the consortium, we have to pay what they call a maintenance of effort. So we have to contribute, it's just over 153,000. And it's been that amount since we joined the consortium back in 2012.
And how does that 153,000 relate to the total expense?
So the total expense for our proposed budget for 2023 is just under $1 million. It's 9.
For economic support.
Correct. For
So,
economic support.
so our cost is about 10% match or a little more.
Yep.
That's very relevant. Thank you.
So I have a question, and this is kind of directed at Tim on finance and personnel, but when I'm looking at the resolutions up here in the previous, number 7, when it talks about reducing by 350,000 in 2024, is that based on the 22 budget, or will that be based on whatever budget is approved this year?
It's based on the proposed 2023 allocation of tax levy.
Okay,
Yep. So what we're working on right now.
okay, thank you for clarifying. Right, anyone else have any questions? I know this is a work in progress because we keep changing things on you.
Sure.
Yes.
I see revenue is up a little bit, but maybe more significant than is abundantly clear in child and youth services. We're anticipating 792,000 in revenue. So excluding tax levy, that is over and above our 22 approved budget, excuse me, as the state become more generous, or where is the increase there?
I think the state has become more generous. There's also additional funds that we're hoping to get. You can correct me if I'm wrong in regards to this. I think what the state continues to do, and correct me if I'm wrong, just in regards to this, is they are trying to get us to try different initiatives to work to getting, keeping children in their home. And so they come up with different programs, increase funding to help with that.
Yes, so they're all grant funded. So the unfortunate part is we have to apply for grants in September and October for those initiatives. And then we find out later in the year whether or not we've been approved for them. So there are some initiatives related to primarily prevention and reunification efforts to try to reduce costs for out-of-home placements, getting children out of placements quicker, keeping them in the community setting, placing with families, those types of things. So we have been able to, that's how currently our family preservation workers are funded, is through those funding sources. So we continue to request additional allocations in those forms. Now, some of them you have to be able to meet certain safety requirements and qualifications to pull the funding down from the state. So it's also, you have to have qualifying families to pull the additional funding. So that's sometimes unfortunate, is that because it's grant funded and because it's not a set allocation, that can sometimes be difficult to pull those allocations, even if you get awarded them. But it has helped in funding part of our youth aid worker position and the family preservation worker positions over this past year. And I can say we have significantly been open to providing more outreach and services to at-risk families than we ever have in the time that I've been at Richland County in the 10 years I've been here. So that funding has helped, and we will continue to advocate and allocate for higher allocations in those amounts. Unfortunately, because they're grant funded, it's not a guarantee.
So eligible families aside, just for the record, I guess, we're at risk of not being able to utilize some of these grants if our staffing level is not where it should be. I mean, we can draw that conclusion, right?
Correct. And that's part of why we added the LTE, Family Preservation Worker, under the Southwest Wisconsin Workforce Development Board. We were able to actually carry over $12,000 from last year to this year from one of those funding sources, because the entire state was underspent because of staffing issues. That helped offset the cost of one of the current family preservation workers, and helps promote for our allocations for next year, because I can advocate adding this position allowed us to serve this many more families, get this many more children home, and or prevent this many more removals to be able to apply for those next year. So that was a benefit to us being a little bit short-staffed, is we utilized one of our positions that was not filled this year, as well as that additional $12,000 to try to provide some of those services to advocate for a full-time or 2 part-time positions in future years.
It's really great. Thank you.
Okay, if there's nothing else, then we will move on to number 17, which is approving the HHS contracts, agreements, and amendments.
Yeah, so we have 2 listed here, both for the Children's Long-Term Support Program families. I wasn't sure if Miranda was going to be on. I don't see her, so I can go ahead. I've worked with Lori Cooey on these, who's also not able to be here today. So the first one is All-Star Elevator. That is for some home modifications. I did text Lori this morning because the elevator name is misleading. I thought we were maybe putting an elevator in, and she said, no, it's actually a platform lift for a family to assist in a child who was typical until a recent accident, then was left in a wheelchair. So they are adding a platform lift assist to their home modification list. So that's the first one. Pocket Therapy is her second one, which is for counseling and therapeutic services. And that one is one of those that's tipping over the 11,000 just to get it in the bigger contract category. So don't believe she plans on spending that much, but that's what we need to do to get the proper paperwork in place.
All right, so I believe we need to have a motion for these.
So move.
Okay. And a second by Cindy Chicker. Any discussion? All right, if there's no discussion, all those in favor, please say aye.
Aye.
Any opposed? Okay, that moves us to number 18, which is approve increase to meal reimbursement rate for volunteer drivers.
Okay, so this was taken to our transportation coordinating committee. So we have volunteer drivers that take people to appointments outside of Richland County, and we have traditionally paid them a meal reimbursement to be able to do that. My understanding from doing some research is that these meal reimbursements have been the same since pre-2006. So we took a look at what they were, and they were for breakfast a $3.50 per meal plus tax and tip, for breakfast $5 for lunch plus tax and tip, and then $10 for dinner. And again, they do have to be out of county in order to get their meals reimbursed. What we're requesting is to increase that breakfast to $5 plus tax and tip, lunch to $7 plus tax and tip, and then no change in the dinner reimbursement. Our drivers, generally, most of them don't even use this, but when they do, it actually costs them more to eat. And if they're gone for a full day, we want to make sure that they're able to have their meal covered because they're giving their time. So we just request that you approve that.
And it looks like it says this is already covered in your budget.
It is.
Okay, thank you. And have you met Mr. Brathwaite?
Oh, I'm sorry.
No, that's okay. I wasn't sure if you'd met previously.
I actually have talked to him. I'm Roxanne from the ADRC.
Mm-hmm.
Yeah.
Awesome. Hey, well, this looks like
Would make
something
a
that's been
motion.
overdue. Yes.
I'll make a motion to approve it.
Okay, motion by Mr. Renish. For a second. Second by Ms. Chicker. Any discussion on this?
A question, please.
Yes, Mr. Sieb.
How many volunteer drivers are there? Am I
Right
speaking to
now,
Roxanne?
yeah.
Yes.
So I believe right now we're 19 or 20. We are down. We had before the pandemic, we had 31. So we kind of fluctuate now anywhere from 19 to 21.
And are these drivers taking people mostly for medical appointments?
They are.
And could I ask you, speaking in behalf of the 4 veterans on the committee, do you transport a number of veterans to medical appointments?
We do. We have done that for years, and we continue to transport veterans. We also do get some donations from local churches for veterans rides. So whenever possible, we do try to transport them at no cost.
And do you have an indication of how many veterans a month you transport?
Oh, I would have to look. We have.
All that you had
Yeah.
an average of about 31 a month a year ago.
Yeah, it's probably about the same. We go to the VA in Madison frequently.
Thank you. And do you have veterans come to your offices quite frequently for other services?
We do. Yeah, they come to the ADRC for a wide variety of things, transportation, our elder benefit specialist, disability benefit specialist, and so forth.
And thank you. It would be interesting to know how many veterans utilize the services of your facility.
Yeah.
Perhaps
Unfortunately,
next time.
there's not a way to really track veterans for those programs, so.
Okay, thank you. But you do
Yeah.
know that you have veterans visit your office almost daily.
Sometimes it just depends on the day, Don. It could be daily, weekly. It just, it kind of just depends on the individual and what
Well,
their needs are.
I've heard very positive things from various veterans about the way they're treated in your offices.
Well, thank you.
Great. Thank you, Roxanne. I think it's great that you're advocating for the volunteer drivers. So we do still need to take a vote on this. So all those in favor, please say aye.
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 Any opposed? Okay. That moves us to number 19, which is approve the ADRC restructuring, which we did talk about this a little bit last month.
We did, and we did have a motion last month, but it was more of a potential restructuring, and now we're moving it to actual restructuring. So this is really just to clean up the language to make sure that our language is the same as Crawford County and Juneau County as well. The Corp Council for Juneau County, where the regional office and fiscal office are held, wanted to make sure that we were consistent across the three counties. So what I'm recommending and asking for is the motion as written on up on the screen, and if you like, I can read it. It is a quite lengthy motion, so I will give that to you, Megan, when you need it. But what I'm requesting is a motion to approve the restructuring of the ADRC by dissolving the ADRC of Eagle Country 4-county region as is currently structured, and authorize the new entity to reapply to the Office of Resource Center Development as a 3-county region named the ADRC of Eagle Country, with Juneau, Richland, and Crawford as the cooperating counties, and forward this recommendation on to the county board for approval. Moreover, this action authorizes Juneau County to continue as the fiscal agent of the ADRC of Eagle Country region and gives authority for Health and Human Services Director Tricia Clements to sign all documents and contracts related to the restructuring, which would be effective January 1st, 2023.
Madam Chair, I move for approval of this motion.
Thank you, Mr. Steep. Second by Mr. Renish. Is there any discussion on this? I know.
I have a question.
Yes, go ahead.
I see that it actually is going to increase the funding by 80,000. Why is Sauk County getting out? Are they joining another coalition to consortium for funding reasons?
Yeah, so they've been thinking about this for years. This has been something, Tim can even confirm this. This has been a discussion ongoing year after year, and it goes on their agenda every year to look at becoming a sole ADRC. And the fiscal implications for them is they would lose money, and the funding would be retained within our new 3-county region. And to be honest with you, this year I just said, I'm tired of this same discussion year after year. We really need to see what are the implications for the other 3 counties. So Crawford, Juneau, and Richland, we all sat down, said, okay, if they leave the region, what does that look like for the rest of us? One thing to know is when a county decides to leave a region, that dissolves the region. So Sauk County really was going to hold the power on whether we stay a region or not. So any county can decide to leave, that dissolves the region. So as we sat down and looked at what the benefits would be, the fiscal benefits really outweighed any other benefits that there were. And we really just, we want to work with counties that want to be a part of the region. We believe in the regional model. And so we want to make sure that the counties that are involved want to be in a region, and it's not just for a financial gain. We work very closely together. I work really closely with Juneau County and Crawford County, and we're able to provide services across our counties cooperatively. So we decided at that point, the other 3 counties, that it just makes more sense financially and programmatically to make this change.
Madam Chair.
So, then is Sauk County aware of this? I mean, the transition, because we're kicking them to the curb, to put it in plumber's terms. So is there a process that we have to go through?
There is. So the regional office and Sauk County is very aware. So yeah, there's been ongoing discussions at our regional board meetings, which they are at. The process the way it looks is that the regional office will notify the state of Wisconsin that we are going to dissolve our 3-county region. We have to have that turned into the state no later than September 1st. And then we have to reapply as a new 3-county region no later than October 1st. So that's why we need to finish all of this language up now. And the regional office then will go forward with notifying the state.
Madam Chair.
Yes, Mr. Seep.
Just to add a dimension, I serve on the Regional ADRC board, and this has been fully discussed and ruminated by our board members and staff for quite some extensive period of time, certainly to our satisfaction. And there is unanimous support for this proposal by the board.
Thank you. Mr. Van Landwit?
So we had a veteran to veteran. I mean, it was really good. Thank you.
Thank you.
All right, any further discussion? If not, we'll take a vote. All those in favor, please say aye. Aye.
Aye.
Any opposed, say no. Okay, motion approved. That will move us to item number 20, which is HHS personnel updates.
Yes. I did think of a couple other things that we do for recruitment that is relevant, is that we reach out to a lot of the universities that we work with that have social work out. So largely April, May, when we got grads coming out of universities like Viterbo. I work with Upper Iowa, and we try to recruit from all those different universities as well that have tossed us people in the past. It's also getting them to move here and find adequate housing and things like that can sometimes be an obstacle for us. But that's one other outreach we do. And then specifically lately, I've been calling old employees that have left that have licensure that is relevant, that still live in this community or in this surrounding area. Just no promises made, just letting them know, hey, go check out the county website. We've got some positions that are available. Check those out. So this is a report that we offer every month of largely it's who's coming in, who's vacating, what we're still advertising for, who's passing probation as a county employee. This is all of our county employees plus leased staff that we have. So I don't know if you want me to review it section by section. It's really informational only. It used to be that this committee had to approve all of these changes and modifications, but now, as you see, I've bolded in the top of the categories who actually approves these. So the top category is approved by the HHS director and the county administrator, and notice is just given to this board. So this is where Tricia mentioned Kaya Holtzman is a new Children's Services case manager. She'll be starting on Monday. Then we also have a probationary period of Elizabeth Muth, our secretary, one of the front desk secretaries. She passed that just a few days ago. No discipline, suspension, termination, layoffs, none of those were relevant this month. Approved by HHS director, notice to county administrator and HHS board is quite a healthy list, unfortunately, this month, which is you never want to see. We have a lot of resignations this month. Allison Barger, our mental health therapist, actually our last one, resigned effective next Thursday. Thursday. Miranda Culver, our Behavioral Health Services Manager, also resigned effective next Thursday. Amber Morris, an Economic Support Specialist, resigns later this month. And then you go into our lease staff. That is Maxie Phillips, Service Facilitator. She was working with CCS, termed out on the 20th of July. And then you'll see we have 3 that are public health. They were largely hired as LTEs during COVID. So we've termed them all because they have not had a number of timesheets for a while. They haven't had the workload. So Southwest would like to term them out. And then if we need to rehire them, we can at a later date. So you have Teresa Landis, a public health clinic nurse, Becky Dahl, public health consultant, and Jay Johnson, public health assistant, all termed on July 30th. Diane Cox was our APS consultant. She resigned July 30th. And Faith Peckham, another service facilitator with CCS, resigned August 10th, just yesterday. That's her last day. No leave of absences, no medical leave of absences. And then we go into the running vacant list. So how this works is I list by category, what unit the position is vacant in, what the title is. And if you see dash currently advertising, that means we're actively trying to fill that job. You'll also see I'll change it to currently interviewing if we are in the interview process and there's a closed date for applications. Now, unfortunately, sometimes we don't get any applications. So we are in currently advertising status for a long period of time past the deadline to submit applications. So we just put position, we're accepting applications until the position is filled. So you'll see every single one of them has 1 vacancy. Other than the mental health therapist, there are 5 that we are currently looking to fill in behavioral health. This goes all the way down to the economic support specialist is the last position. So if you add all those up, that's 10 vacant full-time county positions. The ones below that are all on hold. Those are positions that we have on the county books. We've filled in the past, but have not been able to fill due to budget constraints. Any questions?
Please.
Yeah, so that's something I'll do next month. I offer an organizational chart. I think you got the one from July that I did for the training that we just did, but I'll update that for September and offer that when we have our next meeting. We'll review that a little closer. Hopefully we'll have some positions filled and names put in those holes, but
Ingrid, Mike. Probably not.
Hello? Oh, there it is. Okay. That takes us to number 20, which is future agenda items. I know Mr. Steep expressed a desire to see the budget for Veteran Service Office continue to be on there. Are there any other requests?
so I think I heard 3 so far that I've been taking notes. So I heard the 2023 Veteran Service Office budget update, the Veteran Service Office hiring practices, and Behavioral Health Services Unit HR plan.
Thank you.
Madam Chairman,
Yes, Mr. Steep.
I've noticed that the format from the ASC 400 accounting program from the county office is somewhat dramatically different than the budget report format for HHS, and I think that it's been somewhat cumbersome for committee members who have not been in the past familiarized with the veteran service format, which the county provides. It's all accounting systems have their own foreign language, and sometimes when you look at a budget, it looks like a foreign language to you if you're not familiar with the format. The HHS one is very understandable and readable. So I have discussed this with Mr. Langbeck, and I've asked Mr. The county clerk, Derek, uh, be invited to our meeting to give us an overview of the format that we're provided with the Veterans Service budget, which is, I think, would be very helpful for our entire committee to get a better understanding and read of that budget format. So I would like that to be on the agenda, an overview by the county clerk of the budget format, provided that he's available. We were hoping he could come today, but with the election going on, it's too busy for him. So I would like that to be on the agenda. Maybe you didn't hear me. Hello?
I heard you, Don. This is Carrie, and I'm on the internet.
Okay, sorry, Don, my microphone stopped working. I actually think that would be very useful. I struggle to understand that budget as well. So I will speak with Mr. Kalish and see if he would be available to give us a brief overview at the next meeting.
Yes, I did talk to him about it. He said he would be willing to, time available.
Okay, thank you. Anyone else?
I also discussed it with Clint.
Okay. I will say to that though, I might look at the length of the agenda. So depending on how long next month's agenda, I think that would be useful, but we'll just kind of go by the length and try to put it on an agenda where it's not already very lengthy.
I would plead in behalf of our veterans that we haven't had much time on the agenda in the past, and maybe we can make up for it next time.
Okay, I understand. Thank you. All right, if nothing else, then we will move to adjourn to next month, which is that will be on the 8th of September, I believe. Okay, motion by Mr. Renish.
Second.
Second by Mr. Severson. All those in favor to adjourn to September 8th, please say aye. Aye. Opposed? All right, thank you. We are adjourned.
Madam Chair?